Firstly, I'd just like to say thank you for joining us today. I'm Nathan, digital content producer for 11 Health. I'm here with Dr. David Ziring. I'd just like to ask you firstly, why did you decide to become a gastroenterologist, and what is it that fascinates you about the intestines?
So, I first became a pediatrician. My father's a pediatrician. He's a developmental pediatrician and takes care of children and young adults with developmental disabilities. So I saw the value in caring for patients with very complex needs and their families, who often were very devoted to them. So that was what instilled upon me the urge to do pediatrics. And then once I was immersed in pediatrics, when my sister was diagnosed with Crohn's disease in college, I became fascinated with taking care of patients with inflammatory bowel disease, and that really stimulated my interest in becoming a gastroenterologist.
That's really interesting. And are there any other aspects of the medical world that interest you, or were you primarily focused in gastroenterology just due to the personal experiences?
So, there's a whole lot that fascinates me about GI. Not only taking care of adolescents and children and their families, but also the physiology of the GI tract, understanding fluids and electrolytes, nutrition. Those are all very important to me. And then being able to do procedures and work with my hands from time to time is something I enjoy doing as well.
We just wanted to know what the greatest advances you have seen in the IBD world over the last few years, if any.
Yeah, so really my interest in intestinal transplant bore out of my interest in immunology in general, understanding what goes into performing an intestinal transplant and taking care of those patients afterwards is incredibly complex and provides all kinds of challenges for somebody who has an interest in immunology. So that's where that came from. When I was working at UCLA and taking care of patients who had intestinal transplants, I understood the need to stay on top of fluids and electrolytes and nutrition so that I could take the best care of patients that I could. Over the last 15 or 20 years that I've been practicing, IBD has come a long way. We've developed all kinds of new medications to take care of patients who have IBD, different ways to manipulate the immune system. And what's fascinating now is we're understanding the role that environment plays in inflammatory bowel disease. So things like diet, the microbiome. Everybody has their own inflammatory bowel disease. Not one treatment works for everyone, and everyone needs to be treated as an individual. That's why we developed these individualized, targeted, personalized care plans for patients, because we recognize that everyone has different needs. Some patients do better with certain medications, others do better with certain diets, and when patients become young professionals, whether they're attorneys or working as engineers, or they happen to be doing other lines of work, they have different needs in terms of their lifestyles. How frequently can they take a medication? How frequently can they take time off from work or school to get these medications? So we have to be cognizant of their needs as we take care of them.
Definitely. Do you think that there will ever be a cure for Crohn's in your lifetime?
I do. It may be when I'm 82 years old, but I do think that we will come up with a cure for IBD. I think that with our understanding of the immune system as it is now, and getting a better understanding of how it interacts with the microbiome, ways to manipulate the microbiome, ways to identify those patients who are most at risk of complications and treating them appropriately, that we can certainly come up with a cure for inflammatory bowel disease and Crohn's disease.
That's really great to hear. Really great to hear. We know that you've been a friend with Michael and advisor for 11 Health for a little bit now. I just wanted to ask you, what was it that first interested you about 11 Health in our company?
I think it was really the human story that I heard. So it was Michael's story in particular, how he was the 11th transplant patient in London, and how he came up with the idea for this product in his hospital bed, the way that he took apart your Wii controller so that he could fashion himself a device that would alert him when his ostomy bag was filling. And I saw that not only could this be used on a commercial basis for consumers on an as seen on TV kind of product, but it really had very significant medical applications. So it could help us manage patients better in terms of making sure that they're getting the fluids that they need, that their electrolytes are well managed, so that we can keep them out of the hospital, keep them from undergoing bouts of kidney injury, and keep them engaged in their lives and away from concerns regarding their ostomies.
11 Health's primary focus right now is ostomy patients. For those who don't know, what percentage of ostomy patients are likely to get an ostomy? Could you enlighten us, and also maybe explain some different types of ostomies and the difference between maybe an ileostomy and a colostomy?
So, in my care of patients who have inflammatory bowel disease, oftentimes when they have ulcerative colitis or Crohn's disease that involves the colon, they require surgical removal of the colon. And that leaves them with an ileostomy, or an outlet from the end of the small intestine, and by removing the diseased segment and providing them the medications that they need, we can keep them in long-term remission while they are managing the needs of their ileostomy. So an ileostomy is an opening at the end of the small intestine. A colostomy is an opening within the colon, and they're managed a bit differently. There are different concerns regarding fluids and electrolytes, but these are all kinds of things that we can do with the help of the Alfred product.
You see hundreds of patients every year as a doctor, and I wonder, what value do you place on patient supporting and mentoring other patients, just like our patient coaching program?
I think it's incredibly important. I think that it's one thing for me to spend 20 minutes in clinic with a patient explaining what life with an ostomy is going to be like. It's quite another for them to interact with somebody who's lived that experience and can share their own particular insights into living with an ostomy. Because patients take information differently from their physicians than they would from a peer.
Exactly.
And if they can get that real world experience and some recommendations for care from somebody who's lived with an ostomy for sometimes years, it often gives them a lot of comfort and confidence in being able to take care of themselves.
Definitely. Do you think that we could ever get to a stage where there is a set of standards adopted by everyone?
I think that with the use of this Alfred device, and generating the data that a rich set of data that the device has the potential to be able to give us, we can come up with a set of standards. Because we can publish the experience of thousands of patients who are using the device. They're providing us with anonymous data that we can then look at and present at these very large clinical conferences to other physicians, so that we can educate them on what do we expect in terms of normal ileostomy outputs. And that will hopefully generate standards around the world, because up until now we've had to rely on patients emptying their ostomies into graduated cylinders or beakers and writing a number out on a piece of paper, and it really hasn't been unified in the way that we need it to be, so that we're able to capture that data effectively.
How can we find you online? What's your...
You can certainly find me on Twitter.
Okay, brilliant.
It's at @dziring, Ziring.
Brilliant.
And I'm always posting on social media the latest and greatest in terms of medical advances.
And Twitter's the way to do that.
And Twitter's the way to do that.
Brilliant. Thank you so much.
You're very
I really
welcome.
appreciate it.